The next sort of questions that might come up as you're working through your ABCs, you're providing oxygen, you're providing bag mask ventilation, you're calling the ICU, or you're just sort of triaging this with the family and the bedside team. What do I need for further evaluation? Do I need labs? Do I need radiography? And when should I get them? The key is, what are they going to add to your exam and your vital signs? And do you need to actually escalate your care prior to or independent of these studies? It's helpful to think of chest x-ray, would be your first pass test if you're worried about respiratory distress. What are you going to do with that data from the chest x-ray that's going to change what you need to do in the short term? First, there's a timing question. Someone will have to call for the radiography tech. They need to come up to the floor. They'll take the x-ray and then read it. That may take 20, 30 minutes, but obviously you're going to need to support the child in the meantime. So in general, we would probably say support the child and then think about what an x-ray would add. The same actually applies for most blood tests. If you think you've got someone who's acutely changing, then you probably need to get them to a different level of care before doing labs, unless there's something on a point of care testing, either a blood sugar test or perhaps a blood gas that you'd want to do immediately. That said, most blood gases aren't going to tell you a lot more other than perhaps pH, your acid-base balance, than you're going to glean from your exam and your basic vital signs. Remember that someone who's hypercarbic may actually have quite an elevated heart rate. Someone who's hypothermic and hypoventilating may actually have a relatively low heart rate. Every circumstance is a little different, but the key is to say, what are these tests going to add to my immediate management? And is there a problem if we delay?